It is established case law of our land that where the meaning of the Constitution is clear and ambiguous, there can be no legislation which would abrogate it. In 2008, the voters of our state voted to amend the state constitution clearly and unambiguously to not only permit embryonic stem cell research, but protect that promising research from laws that, quote, prevent, restrict, obstruct, or discourage it. That's in Article 1, Section 27, Sub 2, Sub D, Sub I. That's in our state constitution. Medical research is by far the most highly regulated industry in the country, more so than environmental protection, more so than food and drug safety, more than workplace safety, more than even child protection. Yet the proposed language in this package of bills will most assuredly obstruct this research in direct contravention to our Constitution and the will of our people. But don't just take my word for it. For example, U of M legal counsel Ed Goldman, which my colleague from the 7th just referred to, says the reporting requirements in both 647 and 649 are clearly intended to frustrate researchers and fertility clinics, not to protect the health of the public. He goes on to opine that there is nothing simple in the reporting requirements, and given the highly regulated nature of stem cell research, they are unnecessary and will serve no public health purpose, and will in fact discourage and create disincentives for the pursuit of this research. Obstructionism. Not only will this impede on embryonic stem cell research, but if you support in vitro fertilization, you should know something about these bills. The American Society for Reproductive Medicine says Senate Bill 649 would impose new state reporting requirements on IVF practitioners who are already required by law to submit their treatment cycle data to the CDC. The reporting requirements in the bill are duplicative, and I'm quoting, duplicative, and in the case of reporting patients' private choice concerning what to do with their frozen stored embryos, intrusive and unnecessary. In vitro fertilization will become more burdensome and more expensive for patients because of these bills. So this amounts to an unprecedented, enormous intrusion into patients' privacy without any legitimate medical or public policy purpose. God forbid you're one of those couples that has been unfortunate and unable to conceive, because now the state is going to penalize and victimize you in your quest to have a family. Is that pro-life? Is that even rational? The bottom line is that these bills are in direct contravention to the clear and unambiguous will of our electorate in adopting the language in our Constitution. The bottom line is that these bills don't save one embryo from destruction. The bottom line is that these bills actually ensure that more embryos go into the garbage. Your yes vote ensures more embryos are destroyed. Your yes vote ensures that there are fewer opportunities for cures. How on God's green earth does that promote life? And toward what public policy end, I ask you? I ask that my comments be listed as my no vote explanation in the Journal.